When we think about the earlier initial presentation of dementia and Down syndrome, while there are common themes in the way that people with dementia, both with and without a learning disability, may present, each situation is influenced by the person themselves, their hobbies and interests, the relationship they have with their carers. To give some examples from clinical experience, some people may present for the first time with seizures. A seizure could be the first thing to happen, and only with hindsight are the more subtle changes considered. The new onset of epilepsy in a person with Down syndrome later in life is most often associated with dementia. And in one situation, the person I worked with, the referral had come to the team via the neurologist at the epilepsy clinic with this in mind. Another way that someone might present is with a personality change. Complaints of memory loss are perhaps less frequent, and instead a friend, relative or carer notices a personality change and may report that the person's becoming more irritable, more stubborn, less tolerant or less sociable. In some instances, depression can be the first presentation, and there's ongoing research into the possibility of depression as a prodromal phase of dementia. And certainly there have been cases where the person's presented with a depressive episode, been treated and recovered, and within a couple of years has started to experience clearer symptoms of dementia. There can be factors around such as bereavements which make things less clear, and people can also experience depressive episodes with absolutely no link to dementia at all. Sometimes people can experience vision changes, and this tends to be something identified in hindsight. Very often there will be other reasons for the change in vision, such as cataracts, and these are then treated, and only afterwards it's evident that the processing of visual information by the brain has been the thing to create the issue. Sometimes people will try and pick up patterns on carpets, tablecloths, grasp at the air near an object. And I suppose on the subject of vision changes, hallucinations are common, visual hallucinations, and seeing animals particularly so. But we would need to be very careful that this was associated with the dementia itself and not a marker for delirium due to, for example, a urine infection. Sometimes people experience changes with their eating and drinking. These changes are very common but do tend to be a later feature in dementia. But it might be that recurrent chest infections associated with aspiration are the first reason for someone to seek health care. Carers may report they have started to mash foods, cut things into smaller pieces, and sometimes a person can lose weight unintentionally, and this might be due to a combination of factors, from changes to their cutlery handling skills, taking longer at meal times, changes to the diet brought about by the modified texture, changes to activity levels, and also underlying physiological changes to the digestive system itself. That there are times when self-care and continence becomes the first reported sign, soiling of underwear associated with less awareness of personal care. Incontinence, however, tends to be fairly late to develop unless it's been a pre-existing feature. Mobility changes can take place. Family and carers often report that the person has started taking their arm when they're out and about. Curbs, steps and stairs can be the reason for this. Mobility slows, it takes longer to get from A to B. The person may get lost going from A to B even when it's a well-established route. And there are also changes to hobbies and interests. At times this can be because of a change in skills as well as a loss of interest. And to give a clinical example of this, 2 ladies I've worked with have been keen knitters, and as their condition has progressed, the way they manipulate the needles and the wool has changed, going from producing completed scarves to winding the wool repetitively to picking at tangles of wool with a single needle. So these are some of the ways that dementia can present in Down syndrome at various stages.